Hey everyone, Dr. Trevor Cates here, and I'm so excited to do the live Q&A with you today. This is your chance to ask questions for me, and the best way I've received so many questions, but the best way at this point to send me additional questions is to send me an Instagram message. So to go on Instagram, send me a DM me an Instagram, and that's the best way. I have a lot of questions I promise to answer through our customer support and also in the Hormones Health and Harmony Facebook group. So please be patient with me as I get through all of the questions. I have received so many fabulous questions from you all. So obviously you've been watching the Hormones Health and Harmony docu-series, and it's brought up more questions for you. Things about stress, menopause, perimenopause, endometriosis, fibroids, fertility concerns, thyroid issues, a lot of other questions. So I'm going to do my best to answer as many of these as possible in the time we have today. But whatever I don't have time for, I'll also be answering questions in the Hormones Health and Harmony Facebook group. So if you're not already part of that group, I would go over to Hormones Health and Harmony Facebook group and just make sure that you post your questions in there. And again, I'm going to do my best with like a lot of questions. So this is really great. So let's talk about this. Now, I do want to remind you, we're ending the Hormones Health and Harmony docu-series today at 6 p.m. Eastern Standard Time. The replay is going away. So if you haven't had a chance to watch that episode, or you haven't had a chance to watch it at all, or you want to watch another, catch it again, go right now. Hormoneseries.com is where you want to go. Hormoneseries.com, or you can also go to hormoneseries.com/trailer, and there you will log in, or you register, and then in your email inbox, you'll get the link to go watch the replay. Right now we're showing all 10 episodes. So we have 9 episodes, and then we came out with a bonus episode with the amazing extra content that we had. So I would highly recommend going there and registering so that you can have that last little bit of time to watch the docu-series for free. Now, for those of you who need more time, we are still also selling the docu-series packages until midnight tonight at 50% off. So right now, the silver, gold, platinum, they're 50% off until midnight. And then they'll go up to full price. That's double what it is now. So if you're interested in buying the docu-series, I highly recommend the silver and the platinum, especially the platinum package. If you're outside of the United States, silver is going to be the best option for you because it's a full digital package. So it's not just the docu-series, but a lot of bonus materials to help you get the most out of the docu-series. So recipes, food and shopping guides. We have all the transcripts. So what I love about the transcripts, especially the digital version, is if you have questions, you can actually go in and do a word search in the transcripts, and it'll pull up, like if you have questions about bioidentical hormones, for example, you could pull up what everybody in the entire docu-series said about bioidentical hormones, and you could shift through that. Or if you're just searching for thyroid, you could do that. So the transcripts are really amazing. I love having that. Again, we have a bunch of other bonuses, so go check it out. To learn more about where you can get the docu-series, you can click the link and get access. So it's easy to just click on the link and then go and find out more about the different packages. And so let's go ahead and dive into some of these questions, because I know there are so many here that we want to cover. All right. So one of the questions I got was from Heather, and I'm just going to say first names here. And if you know who you are, at least you'll be listening for your first name. Heather had a question. What is the best way to decrease cortisol? I have PTSD and my cortisol has been high for a long time. The other is my birth control. My OB/GYN said that it raises cholesterol. I guess this is a multi-question. So let me talk to you about the cortisol. First of all, So with cortisol, a lot of times people think when they're stressed, they just have high cortisol. But what happens with stress is that your cortisol can either be high or it can be low. So ideally, we want it to be high and low at the right times. Our cortisol hormone is a really, really good hormone because when it's high, it helps us get out of the way of danger. So we want it, or it helps us kind of be motivated. So when it should be high in the morning, which is normal and healthy, to help us get out of the bed and not have to rely upon caffeine to get us through the day. And then it should then start to drop off before you go to sleep at night. And that drop in cortisol is what helps us transition to sleep. So ideally, I mean, we don't really want high cortisol all the time. We don't want low cortisol all the time. And we certainly want those changes. So when you say you have high cortisol, when you say when it decreased cortisol, did you actually have it tested? So that would be the first thing, is make sure, if you're interested in treating your adrenals, you do a cortisol test. So you can either do that as a urine or a saliva test. Now, most doctors will not order this in conventional medical practices. So this is more what you would do with a functional medicine doctor or a naturopathic doctor. If you only have access to a conventional medicine doctor, you could still do blood work for cortisol, and you would just have it done in the morning, and just to see if it's where it should be. But that's more if you think you have low cortisol, but you said you have high cortisol. So the first thing is to test. Get a doctor to run a salivary or urine cortisol on you, because then you can collect throughout the day. It's a multiple collection. That's what you want to make sure you're getting. And so that you know what your levels are doing. So if you do have high cortisol at night, then I'm going to answer that. So the first part is you've got to make sure that this is actually true. Because if you don't know that your cortisol is high, you don't want to treat it with the wrong herbs or the wrong approach. So if it is high, like say it's high in the evening and you can't fall asleep at night, that's one of the common symptoms of high cortisol. Maybe it's even like you feel like your heart's racing, or you're just can't go to sleep at night. So some of the herbs, there's some great adaptogenic herbs. You just mentioned PTSD and stress. Adaptogenic herbs are really, really great for helping with your balancing your adrenals. So a lot of times, whether your adrenals are high or low, there are some adaptogenic herbs that can help just create balance. And so those are herbs like ashwagandha, like we have in the Spa Doctors, our supplement Stress Adapt. There's also, but there are herbs that help with lowering that evening cortisol, like magnolia bark extract. And you're going to love the name of this next one. It's called horny goatweed. Yeah, that's right. You can imagine in medical school how much fun we had when we were trying to memorize all those botanicals, how much fun we had with that one. It does have another name, but it's not nearly as fun as that one. And so those are some of the herbs that can actually help with cortisol management. But again, make sure you know what you're addressing. And this is why it's really great to test. So it's great to work with a functional medicine doctor or a naturopathic physician. Okay, I'm going to keep moving on with these questions. So Charmel had actually 3 questions, I think. I'm going to go ahead and just answer the first one here. How can we tell the difference between needing hormonal support versus actually going into early menopause? Is menopause ever able to be delayed? I'm 42 years old and have been trying to conceive for a couple of years, but preparing my body for the last 5. So I've been told 4 different doctors I can't get pregnant. Okay, it goes on and on. So I'm just gonna kind of give a synopsis here, because basically what she's asking me is when, is there things you can do if you're like, I want to have a baby now, and I know I'm in my maybe my late 30s, my early 40s, maybe even showing signs of perimenopause, which is very common for perimenopausal symptoms to start showing up as early as your 30s. So you might start noticing some changes. That's why it can be a little bit harder for some women to get pregnant at those times. So definitely what you want to do is you want to do the most you can to balance your hormones. Working with someone that can test with more of the comprehensive testing. That's going to be really one of the best things that you can do. So, it's such an individual thing. It's hard to know if you're still going to be able to conceive. But I like to think that most women can still have a really good chance of getting pregnant. They just need the right support. A lot of it goes back to your gut health. And we talk a lot about this in the docuseries, the importance of your gut health. And so I know it might seem weird that your gut would be connected to your hormones and that would help you get pregnant, or improve your fertility. But it's true. It goes back to our gut health, cleaning up your diet, eating really, really clean, and making sure that your gut microbiome is in a balanced place, and then working with a doctor that can do like a functional medicine doctor or naturopathic doctor who can do more of these specialty lab tests, like the urine test, to look at your hormones and your hormone metabolites, and other tests. There are some other blood tests and things that a doctor could run to see what your chances are. So here's the thing. This is really, really, really important, because I know there's so many questions that actually will go back to this. When I work with patients, I do two things. We got to look at labs, but we also have to look at the patient. So you can't just look at labs and you can't just look at the patient. You have to do both. And so that's why labs are so important. But also we can't just look at labs and know all the answers. We have to look at both. So what are your symptoms? What is your family history? What you actually did mention, as you kind of went on to explain, that the women in your family tend to go through menopause early. When we do know that family history, when it comes to menopause, there's a lot of correlation there. So if you can ask your mom, this is for everyone out there, if you haven't hit menopause yet, ask your mothers, sisters, older sisters, aunts, other grandmother, whatever, anybody else in your family, what their menopause is like. Do it now before it's too late and you don't get a chance to ask them. It's definitely something that is genetic. There's a lot of genetic play into how your hormones are, especially during transitions like menarche, when your period starts and when your period stops, at menopause. So it is good to look at your family. So, but that doesn't mean that you're stuck with your genes. Just like we talk about in the docu-series, there are a lot of things we can do to change our genetic expression and to help support our bodies to overcome those obstacles. But knowing what your family went through, the other women in your family went through, that gives us as practitioners, it gives us a little insider scoop on what to kind of expect. So I know that you've had some great tests done. I would just encourage you to keep trying. I do think that there are ways that you can, I wouldn't say you're delaying menopause. I'm just saying that you're improving your chances of getting pregnant, because I don't want anybody to think, I don't know, I just talked to a woman the other day who was like, I can't wait for menopause. So it's definitely not something that we want to dread, but it's also something we don't want it to come before it's our time, especially if we're still hoping to have a baby. So best of luck to you with that. I know you have multiple questions. I'll come back to that. I know that I do have a lot of questions here, and a lot of this will be answered in the docu-series. So if you haven't had a chance to watch all the episodes, you can still buy the docu-series packages before midnight tonight at 50% off. After midnight tonight, they go up to full price, that double the price of what they are now. I highly recommend the platinum package because it's got the transcripts, it's got guides, it's got the lab video. I interviewed another doctor who consults other doctors on how to interpret lab tests. And I'm talking about these specialty labs like the urine hormone test, heavy metal tests, and all kinds of other tests. She consults other doctors on how to do these tests. So I interviewed her, and that's one of the bonuses you get when you get the platinum package. And we have more of these live Q&As together. So if you need more of this, then that's for you. So want to make sure that you know about that. Don't miss out on these packages. I promise you, that's one of the best investments you'll make. And then, like I said, with the transcripts, those are gold that you can go through and get. I mean, this is why I interviewed all these experts, why I interviewed over 50 experts. It's because I don't have all the answers. I don't have all your answers. I have a certain amount of knowledge, but that's why I wanted to bring in all these experts that specialize in fertility. I don't specialize in fertility. I have worked with patients who were having difficulty getting pregnant and they got pregnant, but that's not my specialty. And so, there are things like that that I think it's good for you to hear from these different experts. And I do work a lot with thyroid and I work with adrenal, but there are doctors who that's all they do. And they're in this docu-series. There are also 3 bonus interviews that you get with the platinum package. Gigi Virgin, Dr. Alan Christensen, who is amazing about all around thyroid, and Dr. Amy Killen, who does anti-aging regenerative medicine. So a lot of really great stuff in the platinum package. So go check that out and you can go to the link here to find out more about that. Okay, so let me go back to your questions. Again, I know there are a lot here. So, okay, this is from Dina. I think I'm checking all the boxes when it comes to menopause symptoms, having a hard time trying to get someone to run the blood work to check my hormone levels. I don't want to just start different supplements and medications. I'm 56 and definitely in menopause. If my OBGYN or primary won't help, where do I start? Gosh, I know this is a big question. I get this. I've gotten this question a lot. So this is similar to what the question that you posted. Anybody else besides Dina posted this question? This is for you as well. So I know it's not always easy to get your doctor to order what you're hoping for. There may be reasons for that. So for one of the things is when you go through menopause, your hormones are pretty much really low. So blood work is not necessarily going to be effective or helpful at really giving you any information because you're not producing hormones on your own. And so when that is for when you're at menopause, after menopause. So most doctors are going to say, no, I'm not going to run your blood work on hormones because it's not going to tell us anything. But there are specialty labs that you can run to learn more. So you can also find out labs. It may not be helpful to learn about your estrogen and progesterone and testosterone, but you could find out information about your DHEA, which is produced by your adrenals, and which is then converted to estrogen and testosterone. And you can also look at your thyroid and your cortisol. And so those are things you could ask your doctor for because we want all of those optimized. Because after menopause, your adrenals actually still make some, and your fat cells still make some hormones. So that is where we want to really provide a lot of support. And you want to make sure your thyroid is working optimally because I see so many women with thyroid disease. In fact, I screen all the women that I've seen over the years, just started running thyroid panels on all of them because I started to see it so much. And the thing is that you want to catch those early. But I'm going to talk about thyroid in a moment. I know you're asking me about menopause. So first of all, knowing that your doctor, there is some validity what your doctor is saying. Yes, blood work is not really going to help you. But if you do go onto bioidentical hormones, if you choose to go that route, which we do talk about in the docu-series, and I know I have more questions about the safety and efficacy of that, which I'll answer in a moment. But if you do that, that's when I think testing is really important. But not blood testing, but urine testing. Again, as we talked about in the docu-series, the hormone metabolites show up in urine. So what's really helps with monitoring safety of doing hormone replacement therapy is looking at your metabolites, how your body is breaking down the hormones that you're being given. So I know I'm kind of getting my head of myself talking about biological hormones with this question, but I definitely wanted to mention that. And there are also supplements, which I'll talk about in a moment, to also help with menopausal symptoms. And so but to answer that was to answer your question. Okay, I'm going to move on to Georgina. And Georgina asked, what if we can't do all the testing, but can find the doctor who believes they have to send hormones if the numbers are in the low range? Not exactly sure I understand this question. My gynecologist thinks that everything is okay because I'm in range, but I'm not okay. Okay, that is something, again, I hear this all the time. My doctor says everything is okay. My labs are normal, but I'm not okay. And that is what I'm talking about, why it's so important to look at labs, but also look at the patient. It's got to look at the person. If you're having symptoms, but your labs look normal, something is not right. Pay attention. And I do have a lot of comments. I've gotten questions in there of like, listen to your body. There's something that women have. We have this innate ability to like be able to have this gut feeling that something's not right. And I think it's actually in us because we have babies and we need to have like that fight or flight, that instinct of like something is going to happen with our family. So we have this innate wisdom. We've got to trust our gut. And if you're having symptoms, there's so much that can be done to help support and balance your hormones. So don't just say like, oh, my labs are normal, so everything's fine. If your doctor is saying that to you, might be a good doctor, but you can find someone else to help you feel great. So you deserve to feel great. You deserve to get rid of symptoms and not have hot flashes and night sweats and PMS and moodiness and insomnia and all that. You do not have to suffer through that just because you're a woman. Believe me, that's why I've done this docu-series to help empower you and know that you have options. So this is really, really important. Thank you for asking that. So she said the question is so she lives in Costa Rica and there are no functional doctors. Well, I don't really know internationally what you can do, but for people who live in the United States, there are two different websites I would suggest going to if you're looking for a practitioner to work with. I would look at naturopathic.org, naturopathic.org. That's the National Association of Naturopathic Physicians website. And they have a find a naturopathic doctor, find an ND on their website. So you click on that at the top, naturopathic.org, click on find an ND, and then it'll ask you where you live. So you put in what city you live in or your zip code, and then it pulls up doctors in your area. Then make sure that this doctor specializes in hormones or endocrinology. So you want to work with someone that is a naturopathic doctor, functional medicine doctor, but that knows a lot about hormones, because not all naturopathic doctors do specialize in that. So that's important. As far as outside the country, I'm really, really not sure. I do know that some of the doctors that were interviewed in our docu-series do telemedicine. And so like Dr. Kieran Dunstan is an example. She does some telemedicine, but I don't know. I also heard in the Facebook group that she doesn't take any international patients. So I don't know the rules around that, unfortunately. But for those of you who are in the United States, and those are some options for you. And then, but if you're outside the United States, you can still inquire about the telemedicine options. I think there's got to be some of the practitioners that will do international work. It's just what's hard is that you have to be able to run labs. You're basically running labs. You're diagnosing and treating, and so you have to practice within your scope, basically wherever you're licensed. And so if it's outside the country, you may not be able to do labs. You wouldn't be able to do bioidentical hormones, most likely. So you got to find somebody. Maybe you have to make a trip to the United States. So if you can't find anybody, but I know that there are people in Europe for sure who do a lot of this work. I just don't know anybody in Costa Rica. And so, and then I also want to tell you, I know a lot of people have asked us about contact information and who in the docu-series is taking patients. And it took us a while. We put everybody's contact information together. For those of you who are joining me for my master class, we have put together an extensive list of all of the practitioners, their contact information, and what they specialize in. So if you haven't heard about my masterclass yet, you can go to hormoneseries.com/6-week-masterclass. But you'll also, if you're on my email list, if you opted in, if you signed up to watch the docu-series, you will be probably getting an email, if you haven't already, about this masterclass, because that was a way for you to work directly with me in a group setting. So this is a 6-week program I'm doing, and one of the perks you get is you get all all of the practitioner information. And that's because part of the reason I'm doing this masterclass is to help you be able to read your own labs, to be able to be the CEO of your own health. As women, we're really good at this role, actually, and making all the decisions for the family, making decisions, and gathering, collecting data, and making these. You got to collect data in the right places, though. So this is the problem: is that people are being told by their doctors, "Oh, your labs are normal," and just, there's nothing more I can do with you, or here, you just need an antidepressant, or here's your sleep medication so you can get through the night and you can still get up and take care of your kids. But believe me, that's not the only way to do it. So if you want to join me for the masterclass, we still have some space available. It is limited space just because I'm trying to keep it small and intimate. So you can sign up for that and join me, and that'll also will give you the practitioner list. So that will be helpful. And okay, so let me go back to answering more of these questions, so many of them. And Bernadette said, "Hi, I have hypothyroidism and take Unithyroid, the generic form of Synthroid. I just had my blood work done and my free T3 was only 1.84. My endocrinologist said all of my labs are okay. This is a theme here to a lot of these questions. My doctor says everything's normal. What do you like your patient's free T3 to be? I have low energy and insomnia and need to lose 15 pounds. Okay, so Bernadette, there is a lot more to thyroid than just T3. T3 is our active thyroid hormone, and it's really important. But you also want to look at your TSH, thyroid stimulating hormone, and your free T4. So you want to when what we call a thyroid, what I consider a thyroid panel. And by the way, that's not like a technical term that you can go to a doctor and say, I want a thyroid panel. A lot of people are saying that, but it's but what I will typically run is a thyroid stimulating hormone, TSH, free T3, free T4, and thyroid antibodies. Thyroid antibodies are really important because if you have an autoimmune thyroid condition, the treatment is different. You need to do some things to support your immune system in addition to your thyroid. It just makes thyroid a little bit trickier to manage. So that would be something, as I would go back to your doctor and say, hey, can I get some more lab work done? And I do, as far as what is the optimal number, it really depends on the other numbers in that thyroid panel, and then also your symptoms. So it sounds like you've got low energy, you've got insomnia. Those are, and you some weight gain, it sounds like. So you've got 3 of the big symptoms of low thyroid function. So I would dig in and just ask for some more lab tests. And if your doctor won't run them, it might be time to find a new doctor. Sorry, but I'm just going to say it. Doctors these days, they have to be more accommodating. And you all are going to be after watching this docuseries, you're now so empowered with information. And all your doctors are going to be like, where did you get all this information from? I'm so excited to get feedback on, see how that all goes. And hopefully they'll work with you, because I think a lot more doctors, conventional doctors, are starting to realize like, oh, okay, we need to run more than just TSH, which is for so many years what all doctors would run. And a lot of times that's what they still run. They'll just run that one test. And then if that's abnormal, then they'll run the other tests. But the problem with that is that TSH has a huge range of what's considered normal. So if it's not flagged out of the range, your doctor's not going to mention it. So it could be that your TSH is like a teeny little bit outside that range, and then it'll be, oh, you're normal. If it's just a tiny bit inside that range. So we want it to be optimal. That's what we want. We want your labs to be optimal, not just normal range. So that's one of the things I talk about in the masterclass is being able to understand your labs, what to talk to your doctor about. One of the things that I do with the masterclass is I have you do some pre-work, and I have you fill out a survey so that you can give me feedback on what you're working on. So that with this particular 6-week group, what I'm going to do is I'm going to customize it for the people that are in the group. So if there are a lot of people with thyroid problems, a lot of people with menopause or fertility or fibroids, endometriosis, PMS, period pain, all of that kind of stuff. It really depends on what you have going on. And but there's a lot of information for you to get just from the docu-series alone. So I know that there's so much there if you still have time to go and watch some of the episodes today. Okay, I'm going to keep moving. So many questions. Vicky says, she asked a question, can taking hormones help with skin problems such as loss of collagen and wrinkling? I've read things from the National Health Institute. This could be true even for people in their 70s. Yeah, our hormones are definitely related to aging, and in particular, estrogen, progesterone, testosterone. So as our estrogen starts to decline, we can start to notice some of the first signs are like more of a dullness, kind of a dullness of the skin. It just doesn't have that same kind of color and vibrancy as it used to have when we were younger, was with that drop in estrogen. Progesterone also is one that gives our skin kind of like the texture and fullness. And testosterone is one that a lot of people don't realize in relationship to aging. And that is when testosterone drops. So one of the things that happens when our testosterone lowers is that we start to lose muscle. And when we start to lose muscle, we have to remember that there's muscle in our face that helps us smile and have facial expressions. And so when our muscles start to decline, it can cause more of the sagging appearance of sagging skin. So absolutely, if you find that bioidentical hormones are a good option for you, again, this is something a very, very personal decision you want to talk to your doctor about, then yes, it could make a difference. And then anything else you can do to support your overall collagen is going to be really, really helpful also. So as a spa doctor, founder of the Spa Doctor, I know a lot about skin. I wrote a book, Clean Skin from Within. I have a natural skincare line, the Spa Doctor skincare line, and we have supplements at the Spa Doctor. And a lot of that is internal and external support for collagen, because as we age, our collagen starts to decline. And our collagen it gives our skin that nice texture and that firmness. But as we age, it starts to decline. Other things that cause collagen to decline are oxidative damage, exposure to toxins in our environment. And so that's one of the reasons why, like smoking, people that smoke, I often see all the wrinkles around their mouth because of that oxidative damage, that free radical damage that's happening, breaking down collagen, that's creating wear and tear on the skin. And so that is definitely something we want to support. So we can support collagen naturally by eating more vitamin C and antioxidants. Vitamin C actually supports our own collagen production, and antioxidants help protect against oxidative damage that speeds up collagen loss. So taking lots of antioxidant rich supplements. That's why the Spa Doctor, we have one of my favorites for this is our Collagen Complete, and it's a powder, and it's collagen and vitamin C and some other herbs and things that support collagen peptides and stuff that support collagen. We also have a vitamin C supplement that also is really great. So you might want to consider some of those things in addition to looking at your hormones. Jane had a question. Which I really like this question. There's so many questions I like. I might be on here for a while so that I can answer all these. And I know that I've got some more questions popping up too. So again, if you haven't already joined our Facebook group, go to the Hormones, Health, and Harmony Facebook group. And I'm going to do my best to answer additional questions in that group. If I don't get to them today, I'm going to try and answer the ones that are, oh, wow, there's so many. And then just a reminder, I do have this masterclass coming up. And then also, if you get the platinum package, I'm going to do another, more live Q&A. So we'll do more of that. So just make sure that you're getting these packages and you're getting the support that you need. Okay. So Jane asks, are bioidentical hormones truly okay to take? As info on Google warns against taking them. Not that I trust Google or mainstream doctors. I do have more faith in functional and naturopathic doctors, but how safe are they? So this is a really, really great question because I get asked this all the time. And as we talk about in the docu-series, I spent a whole act in the docu-series talking about bioidentical hormones and debunking a lot of the myths around the safety. One of the things to think about is that, just for those of you, just a kind of a refresher, or for any of you who haven't had a chance to watch this part of the docu-series yet, is that bioidentical hormones are different than synthetic hormones. So this is very, very important, very different things. A Women's Health Initiative study that scared doctors away from recommending hormone therapy for patients were Premarin, Provera. These were synthetic or equine mare urine. That's not what I'm talking about. Bioidentical hormones are something very different, and that's what we talk about as being a better, much, much safer alternative. So here's the thing, is that bioidentical hormones are molecularly the same as your own hormones. That is not the case with Premarin, Provera, these other synthetic forms. It's very different. So they're made from plants in a lab to be molecularly the same as your own hormones. So here's the thing. When I do see it, you can go on Google, and there's still doctors, there's still people saying that there's not enough safety data. That's actually, there's a lot of safety, and there is a lot of research on bioidentical hormones now. However, most of it's in Europe. So you have to go and look at different places to find the research on this. So there are a few things to think about here. One is that, remember, as we talked about in the docu-series, bioidentical hormones, they can't be trademarked. So who's going to fund a study for something that can't be trademarked? Medical research is done usually by, a lot of times, big research is done by pharmaceutical companies. But if a pharmaceutical company said, okay, we're going to pay for this really big study on bioidentical hormones, and then it came out and it showed all this great stuff, well, then all these other companies would just hop on board, and everybody would start doing it, which would be rising tide lifts all boats. But unfortunately, that's not how our pharmaceutical company, that's not how big pharma works. They're all looking out to make money for their own company. So they're going to focus their research on something that they can patent, something that they can, that they can control, and so that they can exclusively sell. So typically that's how it works. So that's why there haven't been big studies, because who's going to fund something like this? But if you go and you look at the research in like England, for example. So what I want to do is encourage you to go look at, if you're interested in really looking at this, go look at the British Journal of General Practice. And there's an article, let's see, this one, I wish I could maybe I'll just share this one here. But you can go and you can see all this information on here, how actually it has been shown that it is safe. So, you look at some of these British journals, for example, there is clear evidence, this is a quote from them, there is clear evidence to support that, in addition to benefit on symptoms, hormone replacement therapy can also play a role in quality of life improvement, prevention of coronary heart disease, osteoporosis, fracture risk, and reduction in mortality. No other treatments for menopause symptoms have demonstrated a similar role. So we absolutely can talk about herbs and nutrients and all of those things, but when it comes to menopause, what happens is our ovaries stop making these hormones. And so, yes, we can still make some from our fat cells, from our adrenal glands, but if we want to avoid certain symptoms, then bioidentical hormones can help replace what our body no longer makes. So that's when bioidentical hormones can be beneficial. Now, this idea of them not being safe, that's like saying, when people say bioidentical hormone therapy is not safe, that's like saying our own hormones are not safe for us. Now, there are some cases where our hormones can go awry and it actually can create problems. So that being said, bioidentical hormone therapy, if you choose that path, you need to work with a really well-trained practitioner and ask them to do regular urine hormone tests so they can look at your metabolites, and that you're doing all the supportive things to help your body's detoxification pathways, and that your body is metabolizing your hormones properly. This is crucial. If you want to do it safely, you've got to do the foundation. You've got to do the healthy eating. You've got to support your gut health. You've got to do all these things. And if you're doing all of those things, then bioidentical hormones will actually work better for you. But I'm not saying that everyone needs to go out there and take them. I'm just saying it is an option. And please don't be afraid of it. Don't let anybody tell you that there's no research, because it's out there. You just have to look a little bit harder and maybe look in some just some journals from England or other places in Europe. And if you want to join my masterclass, I can share all the research in there. Actually, I think I'll probably post in the Facebook group some of these articles so you guys can see how this there has been research to show that they are safe. Okay, again, caveat, do it in the right balance. I mean, and too much water can be harmful to your health. So anything in moderation and customize for your unique needs. Okay, I'm moving on to the next question. I could talk about that for a really long time. So Shelly asked, she said, how will you know when a hysterectomy might just be inevitable? So when Shelly posted this in Facebook group, I got some other women also posting that they have been in similar situations. So I know Kim and Jerry, you also posted something right below it. And I know this can be a really scary thing when you're a woman and your doctor says your only option is a hysterectomy. So let me take a few minutes to talk about this, and then I'll do my best to answer as many questions as I can. But please know the Facebook group is a great place to go. I'm going to do my best to answer as many questions as possible. But honestly, if you want more interaction with me, then I would highly recommend signing up for my masterclass. It's 6 weeks. We're doing it, and you would be joining me in a group setting if you join us, and it's a great way to get more information. And we can really go through, and so you can be in charge of your own health, know what to talk to your doctor about, how to find the right practitioner. And we're also going to be in my masterclass. We're going to be doing my 7-day program and my summer reset. So I have a new book coming out in September, and you'll be the first to actually have access to it. My publisher agreed to let people that do my masterclass have early access to the digital version of my new book, Natural Beauty Reset. And it is the 7-day plan to harmonize hormones and restore radiance. And there is a 7-day plan for each season in my book. And we are going to, in the masterclass, go together through the summer program. So I'm so excited to do this, because this is even out there yet, and you'll get to join me. If you're whoever's doing the masterclass with me, will get to join me for this and do the 7-day reset together. So, but it's 6 weeks, so we're doing weekly calls. That's going to be part of it. We'll also be talking about labs, finding the right practitioner, getting your questions answered, because obviously there are a lot of them. Okay, let's go back to Shelly's question. It's been tough for me to make a decision. I'm 52 and perimenopause for 3 years. I had an ultrasound done and they found several fibroids, one pretty large. I changed my keto diet to Dr. Quebecca's. That's great. Dr. Anna Quebeca is one of our, she's one of our experts in the series. She has a keto green diet. So you said her symptoms improve. Okay, well, that's a great sign. You're great sign you're going in the right directions. We have to remember that symptoms are the signs our body is giving us. It's like, hey, pay attention. And so, it's really important to look at symptoms. And so if your symptoms are improving, that's a great sign. So I know the doctor is leaning towards surgery because of the fibroids. He won't test my hormones, and I figure that's because he thinks I'll be in full-blown menopause soon and just wants to put me on estrogen. Okay, so first of all, you shouldn't be put on estrogen if you, we definitely, if they're thinking about giving it a hysterectomy, don't do that unless you have, let's not do hormones unless you do get a hysterectomy, or in case you really do need it. You don't want to just jump into estrogen. Okay, so I think really getting a hysterectomy is a tough one. There are some times when you've got such large a uterine a tumor or fibroids or something going on where there's so much pain and there's it's so large that the only option is to do a hysterectomy. So if you're at that point, there's really not a ton you can do. However, there are so many times I've heard miraculous stories of fibroids reducing, getting endometriosis getting better, and women who were told they needed a hysterectomy, women with, all kinds of issues told they need a hysterectomy, getting better. And so some of the things to think about are, again, a lot of the stuff we talk about in the docu-series about clean eating, getting it back to your gut health. And because what we want to do is we want to reduce the inflammation in your body. A lot of the things that cause things like endometriosis or fibroids or things to really grow and build is internal inflammation. So if we get that under control and we get your hormones balanced, then you're going to be, and you're often, a lot of these women tend to be more estrogen dominant, which we talked about in the docu-series. So if we get your estrogen dominance under control, we do, estrogen metabolism, make sure your metabolites are where they need to be, and doing things like eating more cruciferous vegetables or taking things like DIM to help. You can actually also, things like Chinese herbs and Chinese medicine, acupuncture, all of these things. And, I'm just giving you some examples, and other herbs can help you with calming down that internal inflammation and balancing your hormones to a place where you may not need a hysterectomy. So don't necessarily just give up the first time you hear a doctor say, oh, you need a hysterectomy, but know that there is a time and place for it. I do think that there are times when hysterectomy is the only choice, but I do know a lot of women who are able to avoid getting a hysterectomy. And I think it's important, when as much as you can, when you can, to do your best for that. And if you've already gone through a hysterectomy, that's okay. There are still things you can do to support your hormonal balance. And if you still have your ovaries intact, that's actually a good sign. So if you don't get a radical hysterectomy with the oophorectomy, just try and if they can, just have the uterus removed and keep your ovaries. So at least you'll still get some hormones from production from that. So hopefully that helps those of you who had the question about hysterectomy. It's really a personal decision. Talk to your doctor about it. One woman in this group said, she really she needed to trust her gut. And I think that is important. It also depends on your age. Jerry says she's 47. So definitely there's, more time between you when you'd go into menopause. So there's, let's see what else we can do to balance your hormones. Okay, so I'm going to keep going here. I'm going over time here, but I know you've got a few questions here. Let me see if I can do some of the ones that are in the group here. Gosh, there's so many questions. Okay. Teresa says, I'm 64 years old and have been on bioidentical hormones for 15 years. Thank God for doctors like you. Thank you. Thank you, Teresa. So how do you heal your thyroid? I'm on Armor Thyroid. It's a really great question. I would highly recommend that you watch Dr. Alan Christensen's interview. We do a deep dive on thyroid. He's one of the bonus interviews that I did for the docu-series. So if you buy one of the packages, you'll get access to it says a surprise bonus interview. That's the one that you'll want to listen to him. And I'll probably have him on the Woman's Doctor podcast soon, so you'll be able to listen to some of his. He's got some great information. Okay, I'm curious, if you don't mind, Teresa. Oh yeah, sorry. There's somebody asking about a question that I was responding to. What hormones help in body growth and weight gain? So body weight, let's talk about weight gain. We talked a lot about weight in especially episode 2 of the Hormones, Health, and Harmony docu-series. So that one is one that we talk a lot about, that things like thyroid, balancing your thyroid absolutely want to do that. And we want to look at we also talked about leptin and ghrelin, appetite hormones, what's going on with those, as well as your sex hormones. Are you in perimenopause or something going on along with that? All of your hormones we want to have balance to help with optimal metabolism. And again, I know that there's so many questions that you all have. So I highly recommend that you go ahead and purchase the docu-series so that you have all this information. It'll be available to you forever. You'll be able to go back to it as much as you want. And I can't emphasize enough these transcripts and how powerful they are with all these experts that I've interviewed, to be able to just do a search when you go to the digital file, do a search for thyroid, do a search for collagen, do a search for facial hair. There's a question here about that. And then you'll see all of these different experts. Whenever anybody mentions facial hair, it pops up. And that's great. So make sure that you go and buy the docu-series today if you are interested in this, because it is going away at midnight tonight. The Hormones, Health, and Harmony docu-series itself, the free live replay weekend, is ending actually in just a few minutes. So it ends at 6 p.m. Eastern Standard Time tonight. So then you can still get the silver, gold, or platinum packages. The silver is the digital version, digital only. So if you live outside the United States, this is your package. Go get that one, because that's the only one available to you, and it's good. But if you live in the United States, go for the platinum, because it's not that much more, and you get everything in silver, plus you get the physical versions of everything. So you get the actual transcripts as a physical version, and then you also get the Spa Doctor natural skincare system, which is normally $200. You go to thespadoctor.com, you'll see it's usually $199, but it's part of the platinum package. So you'll see there's a really good deal. Just click on the button to go check out the packages, because you'll see how much is in these. You've got the lab video that I mentioned is part of the platinum package. And so we did a deep dive on labs, and we talk about thyroid, we talk about estrogen, progesterone, testosterone, DHEA. We talk about all the different types of tests, blood versus urine versus saliva. So we cover it all, and what to look for, how to know if it's optimal, how to know if it's not. And then I also have Suzanne Summers. Her interview is in these. You can catch her interview. She's got some great nuggets of wisdom. She's great inspiration. If you want a little inspiration, listening to Suzanne Summers' interview is really, really good. You've also got my natural remedies guide. So I know a lot of you have been asking me, what are the herbs I can take for this? What can I do for this? So I know there were some questions like on menopause symptoms. What can I do for that? There are herbs like black cohosh that can help with hot flashes. So these are really, really great things to know about. And that's, in this guide, the natural remedies guide. So I put in there, if you have high estrogen or estrogen dominance, here are some things that you want to consider and take. Low estrogen, low progesterone, low cortisol, high cortisol. What are low thyroid, high thyroid? How to know if you're having these, and you gotta address them. And there are a lot of things we can do naturally. I know we've talked about bioidentical hormone and those can be great. Bioidentical hormones can be great, but there's so much we can do naturally with the foods that we eat, and herbs and nutrients. Things like vitamin C, vitamin E, B vitamins are so crucial. Magnesium is one of the nutrients I think that came up most in the docu-series, so much about magnesium. And so, all of these things, I talk about these in the bonuses that you get with the platinum package. So go check that out. And then I also would recommend, if you want to be with me a little bit longer, then sign up for the masterclass. It is a 6-week masterclass, and we are going to be covering all kinds of great things, your labs, how to find a great practitioner. You're going to have the resources of different practitioners and their contact information, what they do, the experts that are in the docu-series. And then you'll also get early access to my new book, Natural Beauty Reset. If you want to go check it out, you can see it's on Amazon, Natural Beauty Reset. It's available for pre-orders right now. If you do my masterclass, you'll get digital access to it before anyone else. And we'll do the 7-day reset for summer with that. Oh my gosh, there's so many other questions. I've got to answer this one because this one was fun. Chandralan, sorry, Chandra Allen. I hope I'm saying your name correctly. What do you take if you feel disconnected emotionally? From what I learned about oxytocin, the love hormone, it seems as though it may be helpful. However, upon reading it, it's mostly with childbirth and breastfeeding. What if you're not doing either? Can someone take oxytocin? And then someone else commented, Georgina, I don't think oxytocin is something you can take, but let's hope she answers this so we know. So oxytocin actually is available as a nasal spray, but you have to get it from, because it's a hormone, it is available through compounding pharmacies. So it's something you would talk to your healthcare provider about, but it's actually there's really interesting research on oxytocin. And again, it is that cuddle hormone, the love hormone. Is released during pregnancy, childbirth, breastfeeding, and then also orgasms, intimacy, touch, those sorts of things. So you actually could work with a doctor who could give that. But typically it's more for people with that are on the autistic spectrum, the spectrum, and then also people with schizophrenia. There's some interesting research on oxytocin. So I thought that was an interesting question and wanted to answer that. Let's see if I can capture any of these other questions that are on here. That what hormones help with facial hair? Well, I would say one of the things that, facial hair, and even in women, it's like it happens, right? But when we're starting to get quite a bit of it, especially long, like dark, coarse hairs, can be a sign of androgen dominance. So sometimes women with like PCOS will have it. So what we want to do is go back to balancing your hormones and looking at your lifestyle and making sure that you don't have any like endocrine disrupting chemicals. We talked a lot about that in the docu-series in episode 4, Too Toxic in particular. We talk about ways to reduce these hormone disrupting chemicals in the environment, how crucial this is. So I do want to give you guys a chance. Oh, I'm sorry. I was going to give you guys a chance to go watch more of the docu-series, but I just realized the viewing of that will be coming down, but you can still buy the packages. The platinum package is the one that I recommend. So again, I know there are so many questions here, but we are all out of time. I was only planning to go for like 40 minutes and it's been an hour now. And I'm sure my husband is like, okay, it's the holiday weekend. It's time to go. I really, truly appreciate all of you joining me and all your enthusiasm asking me all these questions. I know you need help. That's why I did this docu-series. So it really matters to me. And I hope you find the support that you're looking for, whether that's in the docu-series, buying one of the packages, joining me in the masterclass, or just reaching out to one of the practitioners that you learned about in the docu-series and trying to work with them. Many of them will do telemedicine now. So good luck. And I really wish the best for all of you. Join me in the Hormones, Health, and Harmony Facebook group. You can also get the membership for the Hormones, Health, and Harmony group in our membership site. That's only $3 a month. So you can also get that. Ruth says, thank you for the docu-series. So helpful. You're very welcome, Ruth, and everyone else. Take care, everyone.